Artificial intelligence, obviously we talk about it so often, it's here to stay, and every day it kind of feels like we're finding new uses for it, including your health.
Yeah, and I think we've all kind of done this, but more and more people are turning to AI to answer questions about what could be going wrong with their body. Our WLWT morning anchor, Stephen Albritton, is diving into the growing trend.
From why does this hurt to this is feeling different, or maybe tell me how much protein I need. All kinds of questions are being fed to artificial intelligence. So we asked a doctor, plain and simple, if seeing Dr. AI is a good idea.
I do use ChatGPT for my health.
I would, but I've never done it.
It's a great start.
I would just rather go to the doctor.
Don't like the idea of AI?
The answer is obviously yes.
AI, your health. Do you use it? We had to find out. So we set up on the banks and in the most scientific way possible, asking people to chime in. The good, the bad, and the unknowns, one Band-Aid at a time.
I am a mom of three kids under 6, and it's difficult for me to get to the doctor.
Convenience, a yes.
It's going to send me into a whole panic attack and everything, and it's going to be like, yeah, you die tomorrow. Like, no.
Uncertainty, a no.
But I find ChatGPT to be very helpful, just with like calculating like my macros and just like what I'm eating on a day-to-day basis.
An easy nutritional backup tool.
How do we know that they're not going to be using that to be pointing out specific products that you need to use, or how you should be fixing your health based on what a lobby says versus what most of the medical field would say?
Skepticism of who's running AI.
It's just something that, like, when I'm searching on my phone or computer, just gets routed through AI, and it does give me better results.
Something you're using and have no idea. To every no, there is a yes.
And I looked into, I'd say, ChatGPT, AI, use these tools to gain more information, more insights, and actually help me get a lot better, more energized, and, feel great.
And for doctors at UC Health, they see more patients saying yes. An apple a day keeps the doctor away, but now using an Apple or any other computer brings questions and possible answers to the doctor.
I love the fact that it provides a great degree of health literacy for people who may not know certain terminology and things like that.
Dr. Chris Lewis, a family health physician with UC, says more patients are taking ownership in their health.
I tell my friends all the time, do the research, be curious first, and then go ahead and find second opinion.
Oh yeah, we Google everything these days, right?
You kind of support the patients in their decision making, maybe give them new information or tweak the plan a little bit. Sometimes the plan might be wrong because AI isn't 100% accurate.
Dr. Lewis has had those conversations, supporting while educating.
There have been instances where someone comes in and says, I think I need this medication. And I have to tell them, well, actually, the medication that AI told you to use interacts with what you're taking for X, Y, or Z. So that personalized touch is still necessary.
Encouraging patients to seek that information, but years of training, practice, and clinical experience can't be replaced.
We don't call it the science of medicine, we call it the art of medicine. And because that requires someone to take information, integrate that information into clinical decision making based on a variety of other factors than what you might be reading on the screen. So.
Dr. Lewis does caution with AI and your health is the rabbit hole, going down a path that may lead you into a doomsday scenario when it could be the complete opposite. He again advises to use it as a guide for questions, not a rule when you visit your doctor. Now, we even asked ChatGPT that very same question and it said a similar answer. It can be useful as a starting point for general health information, maybe understand your symptoms, but here it is. It shouldn't replace a licensed medical professional. Stephen Albritton, WLWT News 5.
All right.